an interview of Joel Fuhrman, MD, by Gene Oswald. Our guest, Dr. Joel Fuhrman, is a board-certified family physician. He specializes in nutritional medicine. He received his medical degree from the University of Pennsylvania in Philadelphia. Dr. Fuhrman offers a clerk rotation for physicians and medical students who are interested in mastering the concepts and methods that he uses and will be discussing here today. A colleague of his, Dr. Neil Barnard, president of the Physicians Committee for Responsible Medicine, has this to say about Dr. Fuhrman. A revolution is occurring in the world of medicine, and Dr. Fuhrman is leading that revolution. He is one of the most remarkable physicians in America. Now, there is a book which I think anyone who is seriously interested in their health would do well to read this book. There is a lot of groundbreaking information in here. On page 81, people who have migraine headaches would certainly be interested in this. When migraine and tension headache patients are placed on low-protein, natural plant-based diets with no refined sweets of any type, they almost all recover within a month, never needing medication or further treatments to control their condition. Our interviewer, Gene Oswald, once had a very serious asthmatic condition and was not responding to conventional treatment, and she struck out on a different route, a different solution for that, and as a result of this, she wrote her first book in which she recounted her experience in going through this treatment process and that of other people that were in this treatment center. In this book, she has 100 really thought-provoking case histories. She wrote a second book, which was on the biography of Herbert M. Shelton. Shelton had a marked impact on the use of and development of therapeutic fasting as we see it today. She also co-authored a book on dieting with Herbert Shelton and Joe Willard, and she did a screenplay on the life of Herbert Shelton. She attended Carthage College in Kenosha, Wisconsin on a scholarship, later getting a degree in education from the University of Wisconsin. So with that...
Thank you for the introduction. A revolution is occurring in the world of medicine today. Dr. Fuhrman is leading that revolution. We are honored and very privileged to have you here in Milwaukee today. Dr. Fuhrman, you say that we have a healthcare crisis in America today. What do you mean by that, and what can we do about it?
Well, it's quite sad that 54% of all Americans die of heart attacks and strokes, and about 35% die of cancer. Right now, we have the most overweight population in the history of the human race. About 80% of the Americans' population is overweight, and about 34% are now considered clinically obese, which means they're more than 1.5 times normal body weight. For an average-sized woman, that would mean about a third of the population weighs more than 185, and for a man, about a third of the population weighs more than 225. The percent of people with the incidence of diseases related to obesity and overweightness, like diabetes and high blood pressure and heart attacks, are increasing, not decreasing. This is especially dismal and sad when we consider that every single heart attack death could have been prevented. There are countries around the world today where you don't see any heart attacks, and we have enough knowledge today. We have enough knowledge about nutritional science and nutritional interventions that people could make such a huge difference in their lives, that they could remove this fear or this risk of having a heart attack hanging over their heads. In other words, if you have a father, a brother, a sister, a mother who has heart disease, high blood pressure, high cholesterol, or maybe somebody who's had their first heart attack, or even a friend or a family member who God forbid, have passed away of heart disease. It's sad to know that these diseases could have been prevented, but the bright side and the encouraging and the message we have to tell you today is that you do not have to be a statistic. We don't have to have half the population dying of these diseases. These diseases are preventable, and we hope to describe the method and information you need to take home with you today, from a lot of which will be given out in this show, which you can protect yourself and your loved ones from these diseases. And if you have an illness like diabetes or high blood pressure or even asthma, fibromyalgia, arthritis, these diseases not only can be prevented, but they can be reversed as well. So, Gene, I think that we have a healthcare crisis in America today because more people are, there's a healthcare crisis, meaning that more money is being spent for medical interventions. Medical interventions being thrust on people after it's like a person falls off a cliff and breaks all their bones, and then we have the best healthcare system in America that can come in, bring them to the hospital, and put their bones back together. But we don't have to have people falling off the cliff. And the healthcare crisis, which costs us millions of dollars and is tremendously expensive, and people and their businesses can't afford all this, all the medical insurance fees are out today. We don't have to have this type of crisis because we can have a much healthier society. People must be informed how life-saving and how effective nutritional intervention and superior nutrition and nutritional excellence can have to remove these diseases that are plaguing Americans. So I think that I'm happy to be here, that we can talk about this in more detail today.
Dr. Fuhrman, what percent of adult Americans have heart disease or hardening of the coronary arteries?
Well, that's a good question. When we autopsy children that die in drownings and car accidents between the ages of 4 and 11, we find that even children have fatty streaks and plaques. So children in this country have heart disease. When the men who were killed in the Vietnam War were autopsied, their average age of death was 19 and a half. More than 75% of those men had atherosclerosis. So the answer to your question is that it's more than 95% of adult Americans over the age of 45. If they're autopsied, they have significant atherosclerosis. You can say that almost all adult Americans have heart disease. The question of who dies of a heart attack and who doesn't, well, that's a complicated question. It has to do with a lot of risk factors. Every American, almost every American, is at risk of dying of a heart attack. A lot of luck is involved, but certainly cholesterol levels, apoproteins, homocysteine, methylmalonic acid, hypertension, smoking, lack of exercise. There's a whole antioxidant status in the body, their overall diet, whether they eat there's something called a holiday heart, where people are more likely to die of a heart attack after eating a rich, high-fat meal on a Monday morning or the day after Thanksgiving or Christmas or New Year's. In other words, there are lots of factors involved. But so many of Americans, almost all Americans, are still at risk of having heart attacks, and it kills more than half of all of us. I give lectures to hospitals, to physicians and grand rounds at various hospitals, teaching physicians how they can incorporate nutritional methods in their practice. We're learning that nutritional intervention is not only care effective, it not only works, but it's cost effective. It's cost effective and care effective. The research shows it's effective. Its application to patient care shows it's effective, can both prevent and even reverse heart disease. And now we have to arm the physician population in America with this information, which they can treat people to get well, rather than just using drugs and surgery. So if you have heart disease, or which most Americans do, if you are on high blood pressure medications, which represents atherosclerosis and stiffening of the blood vessels, if you feel you're at risk of coming down with an illness or chronic ailment, or even something that could cut short your life, let me give you the good information, the optimistic viewpoint, that if you make the decision to make significant changes in what you do, you could reverse these diseases and take this live hand grenade that's ready to explode and diffuse it and remove it. You do not have to be a statistic. You do not have to die of heart disease. You just have to make changes that are significant enough to afford your body the ability to reverse itself. So hopefully we'll be able to, give more information about this subject.
Dr. Fuhrman, do we see so many heart attacks and so many overweight people in other parts of the world?
No, we don't, but maybe we should discuss exactly what is it that Americans do that cause 90% of us to have heart disease. I'm saying that if you have high blood pressure heart disease, that about 95% of you could throw away your medication within 1 year. Your blood pressure could normalize, your weight could normalize, and your heart disease could significantly begin to reverse. I'm making that radical statement that if you make enough change, and that there are countries around the world, obviously, that have no heart attacks. We have 50% of people dying of heart disease. Countries around the world have 5%, 1%, half of 1%. But but let's get into what Americans do eat. What is it that Americans are doing that cause these problems? And let's discuss that just for a minute, if it's okay. That the American diet is 40% of calories from animal products. And animal products people know are things like chicken and turkey and meat and cheese and dairy. And then we have 51% of the American diet comes from processed foods. So 51% of what Americans eat comes from bread, pasta, bagels, English muffins, mayonnaise, salad oils, donuts, cookies, crackers, rice cakes, soft drinks, puff cereals. So wake up in the morning, people have, some maybe a glass of milk on cornflakes, a candy bar, like a breakfast bar or something. They're off to work, and for lunch they have a sandwich with white bread and cheese or meat with a soda or something. In other words, mostly what Americans eat are some combination of processed foods or animal products. The amount of vegetation, the amount of plant food consumed in America is less than 9% of what a total caloric intake. Now let's look at that 9% in more detail, because half the vegetation consumed in America is potatoes. So that brings that 9% already down to 5%. And half the potatoes are fries and chips. Part of that vegetation is still consumed as refined products, either fried or overly cooked or cooked in a way where it loses most of the nutrition. So let's say it's closer to about 5% of total caloric intake in the American diet from unrefined plant foods. Now, in countries that have, so with that 5% of intake of unrefined plant foods, we know that countries that consume between 4 and 10% of unrefined plant foods in the diet, we look at those countries, and the World Health Organization puts out statistics, and we see that countries in that range of unrefined plant food all have high heart attack rates. When you get up to 50% of unrefined plant food in the diet, things like, fresh vegetables, like green vegetables, like broccoli, string beans, artichokes, asparagus, kale, collards, Swiss chard, spinach, orange vegetables like sweet potatoes and squash and corn and carrots and peas, beans, nuts and seeds, fresh fruits. When we see countries who eat these mostly poor areas of the world that are subsistence farmers, in other words, they live on what they can grow mostly in their backyard, and they're not eating a lot of animal products. They're too poor. They can't afford to eat a lot of animal foods in their diet. And they can't buy a lot of processed foods. They're not available in their marketplace. And if we look at statistics from maybe 10 or 20 years ago, where lots of these areas of the world existed, we see in those areas of the world where they're consuming 80-90% of their diet from unrefined plant foods, we saw less than 1% of the populations dying of these diseases like heart disease and cancer. No high blood pressure, no diabetes. And the fascinating thing is in those areas of the world where we see no heart attacks, no strokes and no diabetes and no high blood pressure, we also do not see autoimmune illnesses. In other words, those parts of the world where they're eating diets with mostly natural food diets of lots of plant foods, we don't see rheumatoid arthritis, multiple sclerosis, asthma, psoriasis, scleroderma, lupus, those diseases that, we have diseases that kill us. We have these diseases that people have reason to fear, but then we have a lot of diseases that just annoy us, that are caused by what we eat as well, that bring every person out there to visit their doctor, 3 to 5 times a year, with gallstones and diverticuli and hemorrhoids and reflux esophagitis and hernias and appendicitis and irritable bowel syndrome and fibromyalgia and headaches and all these things and that cause joint pains, and all these things that cause Americans to visit their doctors are largely caused by our poor diets and by the fact that your body is so stressed out and malnourished that it's so fragile, ready to break down from the most smallest degree of stress. Even anxiety and depression is linked to what you eat, in the sense that when you have superior nutrition, when your body has nutritional excellence, your brain is much more resistant to stress and won't break down and be thrown into depression or anxiety as easily. The point I'm making is that most of what brings people in to visit doctors' offices can be ameliorated, can be lessened, and in many cases completely cured or reversed in its tracks if people would choose to use some of this modern nutritional information we have available today.
Mm-hmm. So what you're saying then, and I read this in your book, Fasting and Eating for Health, more or less we're killing ourselves with our knife and fork.
Right.
So this is related to obesity and the epidemic that is occurring today. Could you elaborate on the how many people are obese?
Yeah, it's a growing epidemic, and we look at what children eat in this country. You know, obviously I have 3 daughters. I go to one daughter in elementary school, one girl in middle school. I can occasionally go to school to meet my daughter at her school for lunch. And I look up and down the table, and I'm just fascinating. It's really amazing to me that rarely do you ever see anybody eating a real food, like a banana or a carrot stick, or a sprig of broccoli or some peas or some walnuts. You know, you never see anybody eating food. They're having chips and pretzels and, you know, white bread sandwiches with bologna, and or they're just eating desserts or soft drinks, and you're wondering, you know, where are people's heads today? Where are their minds? How do they think the human body can survive without nourishment? We're learning that nutritional scientists, on the other hand, are learning every day. We're learning more about undiscovered nutrients that are found in natural foods, like fruits and vegetables. We're learning about something called phytochemicals, like sulforaphane and indole 3-carbinol and limonene. And, you know, we're learning about all these nutrients, and we've discovered more than 1,000 of them. And every day, science is discovering more. And we're learning that the amount and diversity, in other words, how much variety of natural plant foods we consume in the diet, can give humans an unprecedented opportunity to live longer than ever was before available in human history. So let me say this very clearly, that right now, with the invention of jet planes and modern refrigeration and running water and flushing toilets and refrigerators in people's homes, we have the opportunity to eat a healthier diet than ever before was possible in human history. If as scientists, we nutritional scientists, we look at what brings about longer life and what prevents disease, we can now actually go to supermarkets all around America and find, you know, fresh vegetables and fresh leafy green lettuces all available all year. Watermelon available in the wintertime. Blueberries, which have been shown to have powerful effects on preventing aging of the brain. In other words, we actually have knowledge for what nutrients are present in foods. We can actually go to the supermarkets, find these foods almost all year round, and consume them, protect our bodies. So we could actually, if we make the right choices, have huge amounts and numbers of people living past the age of 90 and 100. And this all has to do with the nutrient per calorie density of the American diet. When we consider food, see, food has a caloric portion. Everybody knows food has calories in it, right? All calories have to come from either fat, carbohydrate, or protein. That's the caloric portion of the food. But now with that food comes a non-caloric portion. So something gives you calories, and then it has things that give us more than just the calories. They give us vitamins, minerals, phytochemicals, bioflavonoids, enzymes, carotenoids, a whole bunch of stuff present in that food, which gives the food a nutritional score or value. If I was going to give you $100, would you want to buy this piece of paper, or this pencil, or a pencil? No, you don't want. You would buy. How about a laptop or a color TV? You want to get value for your money. So if I'm going to give you 1,000 caloric bucks to spend today on food, what's going to give you the ability to live a long, healthy life? If you spend those 1,000 caloric bucks on cotton candy, or English muffins, or bagels, which have virtually no nutrients in it, or olive oil, which is mostly just empty calories and a little vitamin E with no other nutrients, or rather, if you use that 1,000 caloric dollars to purchase foods that are rich in nutrients, what do you think is going to work better? What do you think is going to give you the availability of disease-proofing your body, of preventing disease or reversing disease? If you take a grain of wheat, a whole grain, and you convert it into a bagel, like pasta or bread, turn it into white flour, you've lost 90% of the fiber. You've lost 96% of the vitamin E that was there initially. You've lost about between 80 and 88% of all trace minerals. things like selenium, molybdenum, vanadium, silicone, chromium, copper, zinc, are lost in processing. The food you're left with, this pasta, this bagel, this white flour product, doesn't have what the whole grain had. It's missing the nutrients. It's not, we're finding out, it's not much difference in eating the burger bun, the English muffin, the bagel or pasta than if you had cotton candy. It's like eating candy. It doesn't have the nutrients to support human function, and because the body senses there's no nutrients coming in, it revs up the appetite to try to eat more, to make up the difference, and it increases your appetite. So because the nutrient density of animal products is so low, and the nutrient density of processed foods are so low, and Americans live on processed foods and animal products and no fruits and vegetables, your bodies are walking around nutritional deprived. And this nutritional deprivation can't be restored by taking a vitamin pill, because most of these nutrients, the majority of them, haven't been discovered yet. So I didn't answer your question. Your question was what percent of people are overweight? And that's, if we look at tables of really healthy, the government says 60 to 70% are overweight, and about 30% are obese. If we look at tables of the really healthy, a lot of my colleagues specializing in medical nutrition, we believe that more than 80% of the population is overweight. We all agree that about 34% are clinically obese. A woman of 5'5", and a normal weight for that would be about 120 pounds. And if you take half of that, which is 60 pounds, add it to the 120, you get 180. That's called obese, 1.5 times normal body weight. So more than 180 pounds is about a third of the population. The message what you're insinuating, and what I wanted to say, and I appreciate for reminding me, is that losing weight becomes impossible not to lose weight if you eat healthy. Losing weight is simple, it's easy, it's not complicated. And I have patients that lose 15 pounds a month the first month they start this dietary regimen. I have patients that lose 30 pounds a month. I have a patient who stayed with me, and he stayed there and was put on a strict nutritional plan because he wanted to lose weight. He went from 247 to 180 in 2-month period. He lost about 60 pounds in 2 months. The weight just pours off these people when they start when they start eating healthy. I have thousands of patients. I have 20,000 patients who've lost huge amounts of weight. My success in weight loss rivals the success of surgeons who specialize in stomach surgical procedures for weight loss, where they cut out part of your stomach and staple the stomach together so you can't eat. In other words, losing weight is very easy. It becomes impossible not to lose weight. The choice is up to you. The choice is up to the people. All they have to do is get the information, follow the plan. They can eat as much food as they want. They just have to eat the right kinds of foods. Some foods, the more foods you eat, the more weight you lose. In other words, you don't have to go around hungry. It's not complicated. You don't have to be a nutritional scientist. You don't have to weigh your food. You don't have to count calories. You just have to eat healthy, and you lose weight effortlessly. And at the same time, the difference between this way of losing weight and some other ways of losing weight is that it's a healthy diet, and a person who doesn't need to lose weight could follow the same diet, and that person won't lose weight. There's slight differences, maybe a little differences in a person who's very overweight. But basically, it's the same plan. They live with the parameters of human biological laws. They live within the way we design a way of living, a diet that fits human biology, designed to extend human life, and people no longer become overweight. You know, in your brain, the hypothalamus controls our appetite. And we have nerves that line the digestive tract. And these nerves that line the digestive tract can sense the food we're eating. It can sense the fiber or bulk of the food, and it can sense the nutritional content of the food, and send messages back to the brain. If the body senses not enough calories, if the body senses not enough fiber or bulk, and not enough nutrients are coming in, it'll send back chemical signals through the hypothalamus, to the brain, for you to eat more food, and it'll increase our appetite. So one reason Americans are so overweight is because they're not in touch with how much food they need, because their brain is causing them to overeat. That's one reason, just one. Another reason they're overweight is because they're food addicts, because all Americans are addicted to food. We learned in medical school that the word addict means when you stop doing something, you get discomfort. That's all it means. It doesn't have a bad connotation. It doesn't mean you're the word drug addict, or it just means that when you that people like to avoid discomfort. So they have a tendency to continue to do the things that prevent discomfort. And when you stop doing something that's harmful, you temporarily get discomfort. Headaches, shakes, weakness, fatigue, irritabilitiness. So people, a lot of times if they stop eating even one meal, they delay eating by an hour, they start to feel uncomfortable. They're not in touch with what true hunger is because they start to feel discomfort before they can feel hungry. So Americans are no longer in touch with true hunger. They're forced to eat because they're addicted to food. In other words, their diet is so unhealthy. Their diet is so disease-causing. They have so much retained metabolic waste. Their body is so overworked that the minute it gets a chance to stop eating for a while, it starts to get symptoms. These symptoms can be caused detoxification or withdrawal, and sometimes they're painful. They can be headaches, weakness, abdominal cramping, abdominal spasm. Most people in America think that these symptoms of discomfort are hunger, and they're induced to eat again before they're really truly hungry. Most Americans never felt hunger in their whole life. They don't know what it feels like. So one reason Americans are overweight, another reason is because they're not in touch with true hunger. And there are other reasons why they're overweight. But
we're eating in between meals and all different times of the day, and this is increasing the problem.
We're eating even, right, we're forced to eat in between meals, and we're forced to eat more calories than we need because we have to eat, even drinking coffee causes people to eat more food. Because the coffee headaches or the coffee withdrawal occurs when the glucose level drops down, when there's no food in the stomach. That's when the body withdraws from toxins best. So the person gets this coffee headache, which can be solved by drinking more coffee, or it can be helped a little bit just by eating food. But the point is that I'm saying is that people aren't in touch with their needs anymore. They're divorced from their biological needs because Americans they're drinking soft drinks, coffee, eating a diet that's not well adapted to the design of the species, and they're in pain if they don't keep putting the poisons in all the time.
Okay, I hope our viewers are listening that just tuned in here. This is Dr. Fuhrman. A revolution is occurring, and I can see that Dr. Fuhrman is ahead of that revolution in modern medicine. I am aware that people are coming from you from not only around the United States, but from parts of the world. And Dr. Fuhrman has been known to have an expertise in nutrition, and you have helped people that had irreversible or chronic illness that no one has ever helped before. We need to know, Dr. Fuhrman, what is your formula?
Well, thanks for bringing that up. Yes, it's true that I have a facility that I take in inpatients, and people come to stay with me from far away. And people don't have to do that to get well, and sometimes it's very helpful. Especially I have patients that come from all over the world. I have people flying in from Germany tomorrow. I have people come from Belgium, Lebanon, England. They come from all over the place, and they go home a month or two later, most often without rheumatoid arthritis, without asthma, without the fibroids have shrunk, their heart disease has melted away, their chest pains are going away, their high blood pressure. I see a huge amount of people with hypertension who come to me because they're sick of taking medications. Either they're getting side effects from taking 3 or 4 medications. I occasionally see patients on 3, 4, and 5 different blood pressure medications simultaneously, and their blood pressure still can't be well enough controlled. And I get referrals from other physicians, from doctors who refer people to me because they say their diabetes is not well controlled with medication. This person needs surgery and needs to lose 60 to 100 pounds in a 3 or 4 month period. This person has a fibroid, they're not a candidate for surgery. They have heart disease where their angioplasty or bypass surgery has been recommended, and their cardiologist sometimes feels that they do better off using an aggressive nutritional approach. The cardiologist very often did not recommend aggressive or invasive therapies that are risky. And sometimes these patients are too ill to even go through these aggressive interventions. And many patients themselves, after being advised to undergo bypass surgery or angioplasty, say they don't want it. They want to do it more natural. I have patients that come to me. I have this man who sits across the desk from me. His name is Bill, and he says to me, Dr. Fuhrman, I went through angioplasty and bypass surgery already. I had post-operative mental confusion that lasted for 6 months after bypass surgery. I didn't even know who I was. Now I'm starting to feel good again. I have chest pains. I went back to the doctors. He told me I needed a second bypass surgery. I'd rather die than go through bypass surgery again. He was sitting there on 9 different medications, having chest pain at rest as he spoke to me. And he couldn't even do a stress test. He was so sick. This man today, 6 years later, Bill, has on no medications, has no symptoms, he's able to take stress tests that have normalized. He's out there enjoying his grandchildren. He has a full and normal life at this point. He's no longer addicted to seeing medical doctors, not running back and forth to the office. He said to me, Dr. Fuhrman, I would eat sawdust to get well. He didn't eat sawdust, but he did follow a very aggressive diet I designed for him, where he ate mostly, I would say, salad and beans and fresh fruits and vegetable dishes. And we designed a diet for him that was really good tasting. He lost the excess weight. The diseases melt away. Bill even did some period of time where he actually did some fasting, which we could talk about in a future show. But he made the choice to say to me that I'll do whatever it takes to get well if you think you could help me. And I see lots of people that you'd be amazed that I sometimes say to people, you know, when I first started out as a practicing physician about 10 years ago, you know, you want to change the world, but I get so much satisfaction and personal reward from helping people like Bill that I don't need to change the world. It's just that when you see this one suffering person that you can help, and you know that you've changed 10 people's lives, 50 people's lives, 100 people's lives, the fact that a person comes in who's suffering, and you can look them in the eye and say, you know what, you can get well and you can be helped. And this is not for everybody. A lot of people don't want to be helped. A lot of people would rather stay sick and just stay consuming their junk food diet, for example, and still popping 10 medications, going to doctors, using their inhalers, going in for surgery. They want to have to do, they don't mind that lifestyle, and they don't want to have to change their diet to get well. And that's okay. And I think I'm a very strong believer in everybody should do what they feel is best for them. And I think that, for example, that if a person wants to smoke, that's their right, as long as they're well informed about the dangers of smoking. If they want to drink milk, that's okay. As long as they're informed that for example, whole milk does increase the risk of cancer, and the amount that it does so, that's fine to continue to do it. But at least you should be informed of the dangers of what you do. You should be informed of the growth of IGF, of insulin growth factor in milk, how much is in there. You should be informed of how much saturated fat and cholesterol is in cheeses. You should know that cheese is worse than meat, for example, as far as promoting heart attack. If you want to smoke cigarettes, eat pizza, if you want to shoot up with heroin, it's okay as long as you know you're an adult, you have a full mind, and you know the dangers of what you're doing. The problem is a lot of Americans don't know the dangers of what they do. They don't know the effects of the choices they're made. Their choices are governed by incorrect information that's marketed to them by industry, by, for example, the dairy industry, who spends $200 million advertising milk mustaches and paying money on lobbyists in Washington to get the FDA to approve bovine growth hormone, or to approve that. In other words, it's people aren't basing decisions on science. They're making decisions based on almost like they've been conditioned to believe what industry wants them to believe, and they're not given the proper information about protecting themselves from illnesses. And so, if you're a person that wants to get well, you have choices. If you're a person who wants to make a more aggressive choice, which some people would be considered radical, what I'm saying to you is this radical choice where you eat a lot healthier, not a little bit healthier, but a lot healthier, can have profound and far-reaching effects on how long you live, and can mean the difference of dropping dead of a heart attack at age 50 or 55, or living free of disease long into an old age like 90 to 100 without problems. So you can extend our lives by 20, 30, and even 40 years longer if we take advantage of this information we have available today.
I noticed in your book that was one point that you said. You said you can't help someone who is only going to cut back from smoking 2 packs of cigarettes to 1 pack of cigarettes. One of the exciting books, Fasting and Eating for Health. Dr. Fuhrman, you have an article here in the Health Science magazine, and that's sponsored by the National Health Association. And in it, I noticed that you have the Dr. Atkins diet. Could you tell us how that diet affects our health?
Yes, well, there are a lot of popular diets today advocate eating a lot of animal products and cutting out carbohydrates in your diet. And those diets, Protein Power, the Heller's diet, Atkins diet, work on some basic principles of human biology and physiology to make people lose weight a little easier. And that's true. A lot of these diets can work for people. But, however, you have to recognize that a lot of the carbohydrate intake, we're primates designed to function on carbohydrate. For example, populations that eat 3 fruits a week compared to populations that eat 3 fruits a day have a 16 times higher risk of cancer rates in populations eating only 3 fruits a week. That fruit eating and carbohydrate eating is absolutely essential for cancer protection. And as animal protein, and other factors are, as saturated fat, arachidonic acid, and even animal protein increases in a person's diet, so does the rate of various cancers. Even lung cancer, ovarian cancer, breast cancer, colon cancer are linked to high levels of certain nitrogenous wastes and animal protein, not just animal fat.
Mm-hmm.
So we're talking about low-fiber diets, diets that are low in phytochemicals, low in protective nutrients, to lose weight. And I tell people that you don't want to look good at your funeral or in a coffin. You don't want to pick a way of losing weight that's going to increase your risk of disease and age you. People who smoke can lose weight, but they get wrinkles around their mouth and eyes or at a young age. Their hair turns gray earlier. It ages their joints. Smoking causes osteoporosis. So it's the same way in Atkins diet. You may be risking your life. You may be increasing risk of disease. You will be aging your body. There is a benefit to those diets, however, because losing weight, no matter how risky a method you choose, is beneficial and can reduce the risk of diabetes and can lower cholesterol and can have certain beneficial effects on the body. So, but the bottom line is, the message I want to give people is that why take a risk to lose weight in an unhealthy manner when you can have a diet that tastes delicious, that gives you great recipes and things that are exciting to eat, and can lose weight in a healthy manner, where you can be secure that what you're doing is best for you the long run. If a nuclear power plant exploded next door and doused us with radiation, we wouldn't die tomorrow or even next year. It would take 15 to 30 years. What you do today affects what will happen to you 15 to 30 years from now. Breast cancer is very effective with what you ate when you're young, in the first 30 years of your life. It's not as effective as strongly by what you eat in the last 10 years of your life, right? So don't do something today that's going to cause problems down the road. Learn to live within. We have to obey the laws of nutritional science and human biology. And these trick diets, most nutritional scientists are in agreement that they're dangerous. They appeal to America's love affair with rich foods. It says to you, eat all the lobster and butter and steak and cream cheese and Munster and Swiss, have bagels and with cheese and cream cheese and cheeseburgers, and eat all you want and still lose weight. And it appeals to people's tendency to want that. But it's not a safe way to do it. And most people, once they're explained the alternative, and they see that there is an alternative, which they can lose weight even better in a healthy manner, most people would choose, I think, not to follow these dangerous diets.
Dr. Fuhrman, I enjoy looking at your website, and I know that you list different places where you speak throughout the country, and I also look at it to see what new literature is available. Evidently, you will be speaking at the NHA, one of the conferences coming up.
Right.
What other activities are you involved in? That's
true. I do speak regularly, and people could turn on my website, which is drfuhrman.com, and they can also contact me or my office through information on the website. That's drfuhrman.com. And I very often speak at various national health organizations, one of which is the National Health Association. And I very much respect that organization, which gives out excellent nutritional information. They have a magazine, which you showed, called Health Science. They have literature available through that organization, and they have conferences that I'm going to lecture at, where doctors like myself will be teaching people how they can make these changes to their life. And it's fun for people because they can learn and also have some recreation, meeting other like-minded people who are also health enthusiasts, people who want to take good care of their health and get well. They could learn from both the physicians like myself and from the lay people, and be put into an environment where they're eating healthy food and having it prepared for them. So it's an exciting, kind of like semi-vacation educational experience. So I thank you for bringing that up.
Dr. Fuhrman, I do have a question. What is wrong with the advice that most people receive when they do go to a physician?
Well, most Americans don't get any advice when they go to a physician. They go in with a medical problem, and the physician is in a rush because he has to see 10 patients an hour if he's going to make a profit. If he's a primary care physician, he's got to see a lot of patients. He can't give you the time you need to really to really delve into exactly your diet, your menu, what you eat for each meal, telling you how much of this food you should eat with you, going through recipes, how to make salads taste better, how to make like green vegetables and eggplant and bean dishes. He doesn't really go through that with you, how you can eat healthy. He mostly has to give you a brief visit, look at your cholesterol level or high blood pressure, give you a medication to lower your blood pressure or cholesterol, and ignore the causes. And sometimes coming into a doctor's office and leaving with a medication is like giving the person a permission slip. It says to them, here, take this pill, it'll lower your blood pressure. You know what, if we never had invented blood pressure medications, if we never had invented cholesterol-lowering drugs, maybe, just maybe, doctors would have been forced to tell people, you know, you have to exercise at least 30 minutes a day, you have to stop smoking, you have to lose that additional 50 pounds and become thin so you only have half an inch of abdominal fat, not 3 inches of abdominal fat. You have to get the fat off your body. And if you eat a pound of raw vegetables a day and a pound of cooked greens every day and a cup of beans every day and 4 fresh fruits a day, and if you follow this plan of eating and you come back to see me next week on this diet, let's see how much weight you lose and let's see if your blood pressure goes down and your cholesterol goes down, maybe if we didn't have drugs, doctors would be forced to get to the cause. And then instead of giving people the false sense of security with this prescription, which is a permission slip, in other words, I take this drug, if I take the drug, the calcium channel blocker or an ACE inhibitor or a beta blocker or a diuretic, and I go back home and eat the same diet that caused the problem to begin with. So what happens is, every week and every month I follow the same diet taking the drug, the atherosclerosis, the underlying disease that causes the essential high blood pressure, continues to advance. So I have this false sense of security that my blood pressure is now controlled, while every day and every month I'm aging my blood vessels until I drop dead of a heart attack. If I never had invented this, medications were never invented, maybe, just maybe, doctors will be forced to pursue giving people advice that will reverse the disease. So now every day they follow, they eat, they go home and they eat with no medication. Every day their disease gets better by a little bit, and they get a little less heart disease. And their risk goes down every day, and 10 or 20 years from now, they have no risk of having a heart attack. So I'm not sure, but the possibility exists that even though drugs can reduce risk, given the same diet people are on, in other words, blood pressure medication, if you're going to keep eating the same diet, and your blood pressure is shot through the roof, with your diastolic is 115, sure, blood pressure medication can reduce the risk of stroke significantly. I'd recommend giving it too. I'm not saying not to give it.
Dr. Fuhrman, we just have just a few more minutes left here. Specifically, could you tell us a little bit more about some of your spectacular cases with arthritis, or I know you mentioned osteoporosis, asthma?
Right. Well, that's the thing, Jean, is that we spoke a lot about the common illnesses Americans get, like diabetes, heart disease, and high blood pressure. But there's also an epidemic of things that just make people suffer, like asthma and rheumatoid arthritis, and allergies, and sinus infections, and chronic ear infections in kids. And the message I want to give people is that these diseases are also preventable and reversible. And that I have many, many patients whose rheumatoid arthritis has completely gone. Even I have people who've deformed from rheumatoid arthritis, whose disease has been cut dead in its tracks by eating healthy now. And sometimes, though, with these autoimmune illnesses, the diet has to be customized for each individual. They can't follow generalized guidelines because sometimes they have particular food intolerances that we have to test for. So we do rotation and elimination. In other words, they do a period where they don't eat for a few days, and they go back on one food at a time until we see what foods work best with them. But the bottom line is that the majority of patients with rheumatoid arthritis can get well without the use of these dangerous medications. And as far as asthma is concerned, my patients who have asthma who've adopted these approaches, a large majority of these people have been able to get off the medications and getting rid of asthma. If we have time, I can give you case histories that are really fascinating, like somebody like Judy Sutterly, whose asthma was so severe, she had to wake up at night using inhalers because she couldn't get away with the medication during the day. Now I had to wake her from the night. That now was on no medication. She calls me the other day and says, Dr. Fuhrman, I'm taking exercise classes, on no medication, I'm enjoying my children, I have no, she was in prison before. She felt that that she had to constantly use her inhalers. She was just in prison, couldn't live a life. And now the people are so grateful being set free because they worked hard. they earn their wellness. If you're a person who's willing to work hard to get well, I'm offering you the optimism and hope that it's not, that your disease problem is not irreversible. Most physicians, you go to a dermatologist, they tell you acne doesn't have anything to do with food. You go to a rheumatologist, they tell you joint pain has nothing to do with what you eat. You go to a gastroenterologist, they tell you that what you eat has nothing to do with irritable bowel syndrome, Crohn's or colitis, or reflux esophagitis. And you go to the cardiologist, and up till recently, and most of them will tell you what you eat doesn't have much to do with your disease either. And they're not giving you, this is not true. It's that the marginal minor changes people make doesn't have much improvement. But if you're willing to make more aggressive, what's considered more radical changes, if you're willing to really eat healthy and have a diet designed for your condition and take, in some cases, the right type of nutritional supplements, you can reverse these diseases.
Dr. Fuhrman, we thank you.